Hello and Assalamu alaikum. Ultrascan Diagnostics here. Now, this is the CBCT of the patient that you had requested. The area of interest is the upper and the lower arch, and the kind doctor has requested for implant placement options. Now, this patient has a canine on the upper right quadrant, has incisors in the upper anterior region. The incisors hold a fixed prosthesis with a cantilever in the distal side of the lower left canine. We've got a lone standing canine in the lower left region. Now, this patient has minimal bone support in most areas. I'm going to take you through the CDCT individually with each teeth. This is the 3D rendering of the patient. Here it is clearly seen that the bone quality is not very good. We've got a buccal defect and a bony defect in the lower arch. We've got a bony pathology in the upper left lateral incisor periapical region. We also have a periapical pathology in the upper right canine region. Now, moving to the transaxial view, which is the proximal view, we will take you through each of the teeth present in the jaw. This is the upper right canine. You can see that there is a very significant periapical pathology. The radiolucency is affecting the buccal cortical plate as well as the palatal side. And the bone in this region is not very healthy. Moving to the lateral incisor, this is the root canal treated tooth. It has a metallic post. We don't see any significant pathology, but we do see that the bone width is insufficient if the tooth is extracted. Moving to the central incisor does not have any periapical pathology, but the bone in this region looks very healthy. Moving to the central incisor on the top left quadrant, the top left central incisor also shows significant bone loss around the tooth. There we go. I'm just going to move it for our kind doctor. So this is the bone support around the tooth is not very significant. We don't see any periapical pathologies associated, but we do see bone loss on the palatal aspect. Moving to the lateral incisor shows a significant periapical pathology. There is absolutely no buccal cortical plate, whereas the palatal bone also seems shows signs of resorption. The bone or the ridge underneath the canine appears to be very healthy, and implant placement can also be done in this region. Moving to the premolar on the top left quadrant, we've got healthy bone. This is D3 quality of the bone because we have thin cortical plate, but we have healthy cancellous bone. Moving to the premolar region, we also have sufficient bone in this region. Moving to the molar region, we do see atrophy of the ridge. The ridge height is not very significant. We've got approximately 3 millimeters of ridge height, and a sinus lift procedure will need to be performed if any implants are to be placed in the molar region. We do have sufficient bone in the tuberosity region. Now, this tuberosity region also shows us that we've got sufficient bone in the retromolar area of the upper left eight, which is basically the tuberosity region where implant placement at an angle is possible. Moving to the top right hand side of the patient. So this is the premolar region where we do have sufficient bone for implant placement, although the bone does not seem to be very homogeneous, but the bone quality in this region is D3. Moving to the molar region in this area, again, the patient has significant atrophy of the ridge and a sinus lift procedure will need to be performed if a implant is to be placed. We do have sufficient bone in the tuberosity region where implant placement can be done. This is again the bone quality in this region is D3 because we don't have very strong cortical plates in this region. Moving to the lower right hand quadrant, this is the lower right hand quadrant. I'm just going to zoom it in for you. The implant in the incisor region, we do have D1 quality of the bone, very thick cortical plate, very minimal cancellous bone. But here we have sufficient bone. If I can measure for you, the bone width, the ridge width is 6.7 millimeters, and approximate height is 10 to 11 millimeters. Moving to the Central incisor region of the lower hand side on the left quadrant, we again have bone, sufficient bone, but the quality of the bone is D1 in this region as well. The lower, we've got a defect, a significant buccal defect or a significant bony defect in the lateral incisor region of the lower left quadrant. The canine appears to be significantly has a significant bone loss, but at the same time does not show any periapical pathology. Moving distal to this tooth, we've got very insufficient bone in terms of bone height. We've got 7 millimeters of bone, which will leave it very insufficient for proper implant placement. Moving to the molar region, we again have very insignificant bone. We don't have sufficient bone height or ridge height from the crest of the ridge to the inferior alveolar nerve. Moving to the lower right quadrant, again, this is the lateral incisor region. We can see a bony defect. We've got a very big bony defect with absolutely no buccal cortical plate. Moving to the canine region, we've got sufficient bone in the canine region. And as we move distal to the mental foramen, we have sufficient bone in terms of bone height. We've got approximately 10 millimeters of bone where implant placement can be successfully done. Now, we have done a few implants that we have placed, and we would like to show our kind doctor where the ideal situation for implant placement is. These are the regions where implant placement can be done for our doctor. These are all the possible areas with the implant placement can be done. Now, these are all the regions where the implants can be placed. Now, we will take you through the transaxial view of each and individual implant placement. This is the upper right canine region. We do have very thin bone, but a 3.8 or a 3.2 implant diameter can be placed with approximately 8.5 to 10 millimeters of length. Moving to the premolar region, you've got some bone implant placement in the premolar region. We can see that the implant will have sufficient bone around in the buccal and the parietal aspect. In the upper second premolar region, we've got a thin ridge, but we do have that the implant can be placed in this region successfully. Moving to the tuberosity region, here you can see that the implant can be placed at an angle. If we can show you that angle, that is approximately going to be something similar to this. This is the implant placed in the tuberosity region if it is placed at an angle with the head towards the midline. Moving to the lower left region, we have insufficient bone, so the implant placement is going to be very difficult. We will need a shorter implant. With the brand that we were advised was Neobiotech. And again, the shortest implant size that we have available is 7.5. If we have a shorter implant of approximately 6.5 in length, then an implant can be placed distal to the mental foramen. Moving to the canine region where we have a lone standing tooth. If this tooth is extracted atraumatically, we do have sufficient bone for implant placement in this region. We have sufficient bone in the anterior region, even though the quality of the bone is D1, but we do have sufficient bone where implants can be placed in the lower central incisor region. We've got an implant placement option in the central incisor region in the right quadrant. We've got implant placement options in the first premolar region, and here you can see the first premolar, if placed slightly lingually, will have sufficient bone around it for implant stability. If we move distal to the mental foramen in the molar region, we've got sufficient bone for molar implant placement. A 4.3 or a 4.5 or a 4 millimeter diameter with 8.5 of length will be sufficient for implant placement, as the ridge can support a relatively thicker implant in the lower molar region. Now, this is the 3D rendering where you can see that all the implants can be placed very systematically and very in a guided fashion in the areas where we do have sufficient bone. An implant planning report will also be shared for our doctor. If you have any further questions, this is the axial view Of the lower arch, all the implants that are placed will be placed in the center of the ridge, avoiding all the bony defects. This is the lower arch axial view, and this is the upper arch axial view where the implants can be placed in the ridge with all the bone that we have available in this region. So if you have any further questions, please feel free to reach to our team. Thank you very much.